everybody, like I said, we had so many questions this month, so let's just roll into the next three. And the first question is, Katie, recently I've been thinking about seeing a therapist, but I'm not sure how to bring up the conversation about wanting to see one. I haven't seen my primary care since I started college 3 years ago, and I'm not sure if I need to see my PC first or not. Also, I'm still on my parents' insurance, so would that mean they would need to be involved? I know a lot of you have questions just like this because many times when we finally decide we need help, we're not quite sure how to really get it. And as far as it goes in the States, you don't need to see your primary care physician, meaning just your regular doctor, first. You can just call your therapist and get in to see them. That's pretty much it. And if you want to utilize your insurance, you just call your insurance, you get the list of who is on the, who's available in your area, and you start making calls and find someone that you connect with. But something to keep in mind is that if we use our parents' insurance and we don't want them to know, we're going to have to make sure that we don't have paper things sent back to your house. That's happened to a lot of my patients where they're in college and technically they're an adult, they're over 18. They don't have to tell their parents if they're seeing anyone, but then those EOBs, those explanation of benefits that insurances send out, they either email or send out paper forms, can possibly go home to your parents. And so when you're utilizing insurance, I would call and ask about that and say, well, if there's anything pertaining to me because I am over 18, can you send it to this address? And that should fix that so that your parents don't find out when you don't really want them to. Now, as far as the details around how to get the help and how to speak up and say, what you need, I find tracking your symptoms, like just keeping a little bullet journal of sorts where you just track how you've been feeling and what's been going on, and keeping it as short and to the point as possible. And when you go in to see someone, just say, hey, these are the symptoms that I'm having, and this is how I'm feeling about it and like what it's affecting. And so those are the things I'd like to change. And that should get you kicked off on the right path and like them be able to create a treatment plan with you that is the most beneficial for you and get you better as quickly as possible. And I also want to add in the caveat that if you're in the UK or other parts of the world, you do have to get a referral from your primary care physician, meaning your regular GP, whoever your doctor is, in order to get treatment for therapy. But I know every country, every system of care is different, but that's kind of how I know it works in like the UK and Canada and Australia. Question number 2. Hey Katie, I hope you're doing well. I am feeling better, thanks. Lately, my living situation has been getting way worse. My mom is getting more hostile and emotionally abusive. She tells me and my father that we are worthless. The yelling has become almost constant. We get screamed at for something as simple as a drop of water on the floor or for putting garbage in an empty garbage bag. I'm able to hide away from it in my room most of the time, but lately I haven't been doing so well coping with this. Totally understand. To make things worse, my dad is in stage 3 kidney failure, and I feel so bad watching her scream at him and tell him he's a failure at life. She purposefully makes him feel more helpless because he can hardly walk. Over the past few weeks, I started to think about self-harming again. I've been distracting though, and it's been working so far, but it hasn't been easy. I know I should move out, but right now I'm dealing with a bully manager at work, and I don't know how much longer I can stay there. Plus, I feel like I'd be abandoning my dad if I left him alone with my mom, and they need me to help pay the bills. I feel so confused and trapped. Why does her rage and anger make me want to destroy myself? Also, what can I do or say to protect my dad and myself when she's verbally attacking us? Any advice would be appreciated. First, I just want to say sorry that this is happening. I know many of us are in situations where our family members are emotionally abusive, verbally abusive, or just plain toxic, and it makes it really hard for us to be at home. And unfortunately, there's nothing we can do to make her stop. And I know maybe you've already realized that, but I just kind of have to say that because a lot of my patients will ask me what they can do to alleviate it, and they'll be like walking on eggshells trying not to upset them. But just remember, this has nothing to do with you. It's all about them and what's going on with them. And so there are a couple ways we can tackle this. Number one, we can kind of keep doing what we're doing, where we're just not at home very much and we avoid them at all costs. I don't know how present your mom is or if you feel this is safe, but another option would be to talk to her about it. And I know that that might not be easy, and I would encourage you to try to use diffused language, meaning like, I don't want you to say like, you're doing this. We use like I statements, and we talk about like how it's really difficult and you worry about your dad's health, and just taking it off of her and putting it onto you and your dad about how you're feeling because of this environment. If she can't hear that and it's only going to make it worse, that's not another option for you, but I just want to throw it out there because I don't, I'm not seeing her, and so I don't really know how she's truly acting. And as far as why it's causing you to want to self-harm, when things feel out of control in our lives, This, I assume, feels really out of control, and it's really triggering for you because she's talking shit and saying you're worthless and bad for reasons that don't make any sense. And so everything in your home life is just really chaotic. And remember, self-injury and eating disorder behavior, addiction, shopaholism, like all the things that we do to like cope can come up when those little buttons are pushed. And she's pushing your buttons. And so that old coping skill that helps us numb out, because it's really uncomfortable to hear someone shout at you like that and then to just feel bad about yourself over and over. That's exhausting and that's not healthy. And so we don't have another way to kind of deal with all that emotional angst, so we want to use the self-injury to numb out. So it's very normal, but I'm glad you're distracting. I would encourage you to get into therapy maybe more frequently. I think the person who asked this question is currently in therapy. I would increase your sessions. I would put together a safety plan, so if things get too bad, a safety plan for your self-injury and also a safety plan for you and your dad. Because my last and final piece of advice is get the hell out. And I know work may be really shitty right now and you're worried about that, but one thing at a time. Right now, we need to get you emotionally safe. I'd take your dad with you and move into an apartment. And that would be that's another option. I know it may not feel like it is, but it is. And that way you're protecting him and yourself. And so I would encourage you just to consider that. And what would rent cost? Maybe we move 10 more minutes farther away from the city that makes it a little bit cheaper. Just for now, I wouldn't sign like a 2-year lease, but maybe see if you can just find like a year or 6 months, or maybe someone will allow you to go month to month. Maybe there's someone at work who's looking for a short-term roommate. I would start looking into options so we can get you out of there, because at the end of the day, this is really, really terrible. And if you can't talk to your mom at all about it, and it sounds like that's not going to be an option, it's just not safe, and we want to get you out of there as soon as possible. Hey you guys, another question came in after I'd filmed the others and I didn't want to forget to add it in. And the question is, Katie, I've been really struggling with feelings of guilt in therapy for sharing about others I care about in my life. I find it difficult to fully express my experiences when I feel like it's going to sound like I'm talking negatively about someone that I love. How can I get past this to deal with the issue without being overwhelmed with guilt? I am constantly backtracking and apologizing for bringing them up. This happens to so many of us, and that is because we can care about people who maybe have done bad things to us in the past. And I would just ask you to consider whether you're perfect. And I know that sounds ridiculous, but what I'm saying is we can't expect everybody to be perfect all the time, and your therapist doesn't expect that of the people that you love in your life. Whether we can be super stressed out, or we can just be emotionally overwhelmed, or we can be going through a really tough time, a lot of different situations can cause us to, do bad things to those we love. And it's not like it's intentional, it's not something that we're doing on purpose, but no one's perfect. We could be immature, and that's why. We could be, going through a big transition. There's a lot of reasons. And so know that your therapist will take that into consideration when it comes to you talking about those you love. And it's still important that you talk about that and talk about those situations, and know that even if you still care about them, that doesn't make your feelings or what you're experiencing invalid. And that's why you're wanting to bring it up. And my main word of advice for this, other than just considering that and knowing that it's okay to talk about people, even if you love them, there can still be bad situations. We all know that. We all have families, right? No one's perfect. We just do the best we can. But I would talk to your therapist about this conundrum. I would talk to them about why it's difficult, because what we need to figure out is why you feel unable to keep talking and you feel like backtracking and apologizing. Because remember, your therapist isn't going to tell anybody about this. So what is it about having someone else know about these bad things that makes you feel guilty? Let's be detectives. I hypothesize it has something to do with boundaries in your life, not really knowing how to uphold them, and also potentially emotional abuse when parents tell us, like, you don't tell anybody about, we don't air our dirty laundry. It could be all of that kind of stuff, which boundaries tie into as well. And the third thing that I hypothesize is it has to do with our own confidence, feeling secure and safe in how we feel and our own experience, and being okay with owning that. And so I would just talk with your therapist, because those are just my hypotheses. I don't know you personally. And so if you figure it out, if you talk about, instead of talking about the issues right away, talk about the struggle you're having, we can figure out where it's coming from. And another hypothesis I have is that might give us more information to figure out what the root of our issues are as a whole. So let's start there, and I promise you it will reveal all of the reasons this is happening and you'll be able to push through. Question number 3. Katie, do you have any advice for when breathing techniques become more of a trigger rather than a grounding tool or resource? That's actually very common, but we'll get into that. With topics I'm working on at present, the sounds of breathing, particularly from my therapist or when she wants me to breathe out loud, is actually making things worse in session lately. I find it so hard to communicate areas like this where I struggle with her, and I don't know how to remove the trigger in it all. It's interesting because a lot of my patients find breathing exercises to be super triggering, as well as other grounding techniques. And so we just need to communicate that to our therapist and let them know this is not one that works for us. And the reason it usually happens, and this might not be the case with you, but with a lot of my patients, they tell me that the sound of breath, especially if there's been like physical or sexual abuse, it can be like a trigger because that's something we maybe heard when the person was coming at us or engaging in the abusive behavior. Breath can be really icky to some of us. And so that's why it doesn't work for everyone. And that's why I'm always saying to come up with different grounding techniques. And I'll have a video coming out soon where I talk about all the different types and other ways that we can access grounding techniques that maybe aren't so triggering, like the breathing. I know a lot of people don't like to go into their body and feel like we've done there's this DBT technique, it's like the circle of light, and you try to imagine it going around down your body and how you feel in each part. If we're working on abuse and PTSD symptoms, being in our body can be really uncomfortable, so that might not be the right one for us. And so just finding the techniques that work for you and kind of navigate around some of those triggers will be the most beneficial now. And trust me, as you keep working forward, keep talking it through, those triggers will be removed and breath will no longer hold such an emotional charge for you, but that's not where you're at right now, and that's completely okay. So just speak to your therapist about it, let her know that it's just not going to work for you, and try to come up with some others that do help you stay grounded and present. I hope you guys found those answers helpful. Thank you as always so much for your support each and every month, but there are so many more questions, so I'll see you over there in the next video. Bye.